Hi there, I'm Ella, and I'm a part of TEH, or Teens for Equality in Healthcare. We are a group of freshmen for Whitney Young Magnet High School, and for our service learning project, we have decided to help combat racism in healthcare. We have actually decided to work with an amazing organization called Westside United. They are an organization that works to combat racism in the west side of Chicago, including racism in healthcare. Racism in healthcare is not a new thing. So Madison, why don't you tell us about the history of the problem?
Sure. Systemic racism in healthcare has always been a problem in our black and brown communities, but it became really evident and known when redlining was introduced. Redlining is when the 1930s Homeowners Loan Corporation, based in Chicago, Illinois, sectioned different parts of Chicago and assessed how much these communities were worth. These assessments were highly inaccurate and based on racially biased white people leaving communities because black people or people of color also lived in those neighborhoods. This is called white flight. These assessments would say that a majority black neighborhood was worth less than a majority white neighborhood simply because of their race. This hurt black communities because it also meant that less time, money, and effort were put into these communities by the people who held important offices in Chicago. This also meant that hospitals and other public spaces in these communities would get less funding because it was deemed that those hospitals were not as important as the hospitals and public spaces in majority white neighborhoods. Jocelyn, how is this affecting current day Chicago?
This issue has become even more prominent now that we are dealing with one of the biggest health problems right now, the COVID-19 pandemic. We've taken a look at how this issue we've selected correlates with the pandemic, and what we found is that healthcare disparities continue to affect minority communities. According to a research done by the Stanford University School of Medicine and Duke University, the researchers did not find any racial or ethnic differences in mortality rates among people hospitalized with the disease. Yet, a disproportionate number of Black and Hispanic people have become sick enough to require hospitalization, and they make up 53 of inpatient deaths. From this study, researchers have concluded that Black and Hispanic people have suffered the most during these times. According to Munoz Prince et al., a professor of medicine, Black patients were 5 times more likely to test positive for COVID-19 than people identifying as belonging to other racial groups. Through all research conducted today and in the past, it's been found that many more factors contribute to the issue, such as historic racial segregation, distributing of housing, transportation, economic opportunity, work conditions, crowded housing, and so on. We can take a small step to help, though, by helping out in some way in our own communities.
Because of this, as we stated earlier, we have decided to work with an amazing organization called Westside United. Alana, can you tell us about this?
Hi, I'm Alana, another member of TEH, and by now you're probably asking yourself, what can you do to help solve racism found in the medical industry? There's this organization called Westside United, also known as WSU, and Westside United noticed how the life expectancy was up to 14 years shorter within the West Side compared to the downtown area of Chicago, and they decided to create the organization to lessen the gap and overcome the racism that can be seen in the medical field. Westside United has stayed committed to helping Chicago for over 4 years now and continues to help today. This group focuses on hospitals in many ways. For example, the organization helps hospitals to hire staff, gain more supplies, and donate money towards specific services such as mental health services so they can improve them. Westside United also helps the community members gain access to CHW grants, which are grants funding for community health workers. In order to help solve racism, poverty, and educational debt, they continue to address the inequality amongst the neighborhoods in Chicago. Westside United also allows the community members to use their own voices and speak on matters so the organization can come up with new ideas and gain more information on how to solve the ongoing issue. WSU also allows their community to get involved in other ways, such as applying for grants, having internship opportunities, and applying for jobs. Since 2017, Westside United has seen more than 1,800 hospital hires, over $6.5 million coordinated for impact and investing into the West Side. They've had over 1,500 community members gain access to health resources through CHW grants, and they have also had over $125,000 in grants to help acquire for more mental health services within the community. With COVID-19 hitting the country, WSU encourages people now more than ever to apply for grants in order to create a better and healthier Chicago.
We are now gathering donations to help support these amazing programs. Thank you.